The contrast in relation to the difference around our awareness of autistic girls and women is quite extraordinary. Yeah. When I was reading stuff back then, it was still like Simon Baron-Cohen's extreme male brain theory was still very dominant and accepted. The change in those 10 years is just quite extraordinary.
Yeah, I agree. When we're talking about girls and women, we're talking about historically, and it literally was a very binary kind of system, and it's more recognized now that there is a variety of people, variety of genders.
There are further potential complications around identifying being autistic for various minority groups. Why did people not know? Why did society not know? Why did educators not know? Why did clinicians not know?
Until recently, when real people have been speaking out on the internet and letting people know what it's like for real people, living real lives who are autistic people, all different types of people, that people can start to say, well, I don't have to be looking for areas of concern. I'm looking for certain elements of lived experience, what it's like to be an autistic person. And that's helped a lot of adults to look at something that they would have never have thought to look at.
There's a whole history in itself attached to girls and women identifying as autistic. So we were talking last time about the difficulties around identifying as autistic or discovering you're autistic or being diagnosed as autistic, or other people around you maybe thinking you might be autistic, and how that fits in with a lot of themes around society just having a narrow view of what autism is, what being autistic is, and whole history around that narrow view, but also the sort of alternative and sometimes also accurate diagnoses that people get, like, an eating disorder or social anxiety or something like that, and how that then kind of blocks maybe the discovery of being autistic. And then where we sort of landed at the end of last week was just that there are further potential complications around identifying being autistic for various minority groups, particularly more and more. This is becoming an issue, I think. But also, there's a whole history in itself attached to girls and women identifying as autistic, or girls and women being identified as autistic. And I'll hand that over to you in a couple of minutes, Vauna, maybe as a woman. One I can't speak to personally, but the way I can speak to it personally is that I discovered I was autistic just over 11 years ago. I discovered it partly because, as I've mentioned here before, partly because of it was beginning to come through a bit in my work. So it was work where I got kind of interested first. It was only then hit me, oh my God, this is me, I need to look at this. And then obviously I was immediately getting, learning everything possible about it, as we do, and particularly professionally as well as an autistic person. And the contrast in those 10 years between what I was reading then in relation to other things like, how well known the neurodiversity paradigm was and things like that. But the contrast in relation to the difference around our awareness of autistic girls and women is quite extraordinary. Yeah. And I was reading stuff back then. So this was like 2013, 14, 15, it was still like, Simon Baron-Cohen's extreme male brain theory was still very dominant and accepted. The statistics around like male versus female prevalence of autism were still like 50-1, that kind of number. The change in those 10 years is just quite extraordinary.
Yeah, I agree, actually. And I mean, I suppose I'd like to start off by saying that when we're talking about girls and women, we're talking about historically, and there wasn't as much recognition or as much communication, as many people talking then about other variations of gender identity, so there were it literally was a very binary kind of system, that was extremely prevalent, and it still is, but it's more recognized now that there is a variety of people, variety of genders. And so we're talking a lot really about assigned female at birth, particularly. People like myself who identify as a female person and was born as a female person. There are lots of reasons why, such as, like the diagnostic criteria in the start being based upon studies of white males. And so the presentation that a female has, or of my age group, when I was at school with my cultural scripting, that was part of my growing up when I was a child, I didn't present like the boys did in our class. You know what I mean? So that would be one of the reasons why nobody thought that to even cross their mind that I might have been an autistic person. That's just one of the reasons.
We're arriving at a better place. I think there's a long way to go, but we are, I think, insofar as there's an autism community forming in the world and on the internet and in various places, I don't see any particular male-female divide. We just identify a huge amount. Autistic people just identify on the autistic stuff. Why wouldn't they? That's what it means to be autistic. You identify on that stuff, on the intense mind and on the finding, neurotypical social life peculiar. And, we just identify on those things. But the thing it reminds me of is that there's a couple of strange aspects of the history of the last 10 years, and unfortunately it's moving in the right direction. But one piece is that somewhere around the middle of the last 10 years, there was quite a long phase where people were talking about female autism.
Oh, right.
I don't know if you remember that. No, but it's like, there's probably more autistic women than we thought, more autistic girls. But so what's the difference with female autism and male autism, And of course, people didn't find anything. No, if you Google it, you'll find articles going back there, as I say to Sandra, 5 or 6 years ago, it was like, well, okay, we admit women can be autistic. So there must be a female autism then that we haven't been seeing and that we didn't know about. And, sure, that's a pity, but sure, we didn't know. And so let's see what female autism is like, rather than like we're autistic. We're just all autistic. Some of us are women and some of us are men and some of us are neither of those things. And some of us don't care whether we're male or female or, but autistic, please just concentrate on that. But that does seem to have died away. And it's kind of nice to hear you. I didn't come across it too much, but yeah, I was certainly coming across it.
One thing I have heard that might be related to a better explanation of that these days is that there can be a tendency for some females or quite a lot of females, let's say, to have an internal, they call it, don't they, an internal expression of autism rather than an external expression. In other words, things have been internalized because expectations, culturally speaking, in terms of cultural scripting, expectations for females have been different, so there's been prohibitions and limitations and restrictions on certain ways of being that might be more influential or more felt more strongly, for a female. And so they've not been allowed to or not been able to express certain things about themselves that are natural traits, but it doesn't mean it's not going on inside.
No, but then those are just male-female differences in our culture. That's the thing.
Yeah.
They're not.
Yeah. Oh, yeah.
A lot of some differences. This is the thing. This is the more, I think, obvious thing. But still, for some reason, people seem to have to take that detour around. Oh, we didn't see this thing called female autism. But no, the differences, I think, are the average differences in our culture anyway. And in the mental health field, for instance, it's well known that internalization versus externalization is a common male-female difference, like depression, anger, addiction. Lots of things tend to be more internalized by women and more externalized by men, So yeah, we know that already. So maybe some of the features of being autistic will be as well. Yeah, it wouldn't be surprised.
Yeah, that's right. I mean, I think I was looking at some stats actually this morning, and I've just got them on my desk here. Girls are diagnosed with autism on average 1.8 years later than boys. So this is in school.
Interesting. Yeah.
And there's so that was one statistic. Now also that autistic children are over 7 times more likely to express gender variance than children with ADHD even. So with another element of neurodiversity.
That's an interesting one, yeah.
Yeah.
And kind of can bring us a bit into that kind of intersectionality bit in a way that we want to talk about as well. But you know, we might come back to that a bit. But the other piece then that I think has been part of the history of the last 10 years, and you know, again, you know, quite a bit of discussion, but also argument around this, and I've seen some people be kind of quite angry about it, and that is, you know, we touched into it last time, I think, the idea that, you know, if we need to explain why, if we assume that, you know, the prevalence, if you want to use that word, not a lovely word really, but the you know, the percentage of people who are autistic in different gendered populations, you know, if it's only slightly less in women, which to be honest I doubt, I suspect it's pretty much equal. It's just gradually moving that direction. The statistic, you know, 50 to 1, 20 to 1, 10 to 1, 9 to 1, 8 to 1, 7 to 1, 6, you know, it's probably 1 to 1 thereabouts, you know, so what? But if that's the case, then why did people not know? Why did society not know? Why did educators not know? Why did clinicians not know? And one of the answers that's given is, you know, it's a little bit tied in with what you're saying about the internalization. Women are better at masking. Yeah. Now, there may be some truth in that depending on how you look at it, but the problem that some people would see with that is that it's good old women blaming again, you know. It's like, well, look, how are we supposed to know if you're all masking so brilliantly? Sure, yeah, like you hid from us, you know.
And even, you know, it occurs to me, even saying that is going back to that autism must be observable.
Yes, that's partly why we were talking about it last week. Yeah, that's right. We're saying that. Yeah, somehow it should be obvious, you know. And why should it be? Like, why not just ask? You know.
Yeah. What's your experience from the inside? What's it like to be you? How are you finding things? Yeah.
Radical idea. Just say, tell us how you are, what's going on, what you find difficult, and what you find confusing, and what you find exciting, and what you like doing, and what you love doing, and you know, all of what we would now do.
And listening for when someone says, "Oh, why do you think about it like that? I don't think like that. This is how I think of it," and taking that seriously.
Yeah.
You know. I mean, the other thing is as well is that, you know, it gets more and more complex, doesn't it? Because if you're a person of color as well, you know, then, and female and autistic or something like that, you know, we've got multiple ways in which you're moving further and further away from the white male stereotype. And can be misunderstood or misinterpreted, and there are great costs really. I think with not being identified or not identifying yourself, because there's a whole load of stuff that you don't know about to help you to gain the supports that you need or to know about your rights, you know. And this is being denied people because they're being left out of being considered, you know, or being informed.
Well, it brings us into that whole territory, and you know, I mean, it's probably, a lot of people would say, even a cis white male stereotype, you know.
Yeah. Oh, quite.
A probably a cis heterosexual white male stereotype, you know, in the end of it all, because that is the dominant stereotype in the neuronormative world. Still a patriarchal, heteronormative, cis-normative world, and that's the bigger picture, as well as a neuronormative world. And yeah, it's like, I mean, I think it both, you know, some of that intersectionality complicates things in terms of the sort of identifying and diagnosis and assessment that we've been talking about. Also just completely, obviously, brings in enormous politically based problems, enormous neglect, oppression, marginalization, where the question of discovery or diagnosis doesn't even arise. I mean, we can come back to that in a few minutes, the confusion again of the various things you're trying to figure out, or that people are if you're lucky, trying to help you with. But the reality is that, there are minority groups that if you belong to, and certainly if you belong to more than one of them, you just fall out of the margins of any societal concern, really. And to be honest,
maybe things don't get considered, like you said, with about like the overshadowing, like other either co-occurring conditions overshadowing the thoughts of whether the person is autistic or misdiagnosis. In fact, that thinking it is something else when it all along was being an autistic person. And likewise, I'm thinking about the transgender people who are not believed about their gender identification because they are known as an autistic person, and it's like, oh, you can't have both of these things. I don't believe you on that one, but I believe you on this one.
Yeah, that's a good point. Yeah, you can have one or the other off the menu, but you can't have more than one. Helen's mentioning there that she's been told it's not advisable for gender non-conforming people to get an official autism diagnosis because it might be a barrier to getting gender affirming care. And one of the reasons is, I think what you're describing is like, now hold on, you can't have a couple of these things. But another one is that it's the epistemic injustice thing. I've just been reading about that again, so it's in the top of my mind. It's like, if you're autistic, then your judgment of your gender isn't reliable.
Quite exactly. That's another one.
You shouldn't trust it. Or how would you know? You don't know about these things, Yeah. So I think Helen's nodding her head there. I think that's part of probably what you're referring to. That happens in this country as well, in Ireland.
Of course.
I've met plenty of examples of exactly that. It's very frightening, So if you're autistic, well, in that case, that's why you've got all this gender stuff mixed up in your head. We don't worry about you then.
Whereas as therapists now, what we know is that autistic people, it's very important that we collaborate. We're saying together, what do we think, what's important to you about this when you're coming into therapy? What's important to you? It's not what I'm going to assume is important. It's what is important to you. Let's decide together what you might want, how you conceptualize what is a healthy, fulfilling, meaningful, joyous life. Not what my idea of it is.
Yeah, who decides what you need? Is it and can you be trusted to decide to identify what your needs are? Yeah.
I mean, if you think about two prominent, very famous autistic stereotypes, what pops in your mind in the media?
I suppose very sort of nerdy, geeky, maybe even a bit geniusy. And
we're talking Dr. Spock and Sheldon, aren't we?
Yeah.
Males.
Yeah. Data the android, kind of white male.
Yeah. Oh, yeah.
But no, I definitely think so. Yeah. And unfortunately, of course, another one is the school shooter, that's always a young white male,
And Greta, when you think about Greta Thunberg, there's something about Greta that people don't like to think of her as female. She's so male. She's an autistic person, with a very intense passion, and is very clear and direct about that. That doesn't mean she's not female or not. Wasn't assigned female at birth, say.
Yeah, I was. She really annoys the hell out of the white male world. There's no doubt about that. I've just started reading an article there by a philosopher called Richard Rorty, pragmatist, and it's actually about feminism. And it's just I'm reading some of his stuff, so I've arrived at this article. But actually, there's bits of it I'm going to take, and I'm going to replace some of the bits of it with autistic and put it up on the internet because it's fascinating just how he captures. It's about epistemic injustice and things like that. Yeah, that's
like you can't know yourself. It's that old chestnut, isn't it? For all autistic people, historically, you can't know yourself. We know who you are. We're defining who you are. We're going to do stuff to you.
But it's very interesting because he's quoting a feminist philosopher, like Catherine McKinnon or somebody, saying that it's still the case that to be acceptable, a woman, particularly in the public sphere, a woman has to either conform to male stereotypes. She has to be a bit of a tough nut, like, for instance, to be a politician, or she has to conform to male's version of female stereotypes. In other words, she has to be a lady as men allow it to be. So Greta Thunberg, for instance, I think doesn't fit either of those. She's not either properly just joining the men's club and going out there and, you know, if she wants to go on about global warming, well, then at least do it in that way, you know. And she's not conforming to their stereotype of a woman either, you know. So it's fascinating. But I think that's also very interesting when you apply it to autistic people and a few other things he says like that. It's like, yeah, we could be allowed to be autistic if we do it this way. But no, don't do it that way. We're now losing control of the narrative, you know. So yeah, there's an awful lot of this opening up, isn't there? Not enough yet, but it is beginning to open.
Yeah, it'd be great, wouldn't it, to have more diverse representations of autistic people.
Exactly.
That actually do reflect real life.
Exactly. That's the thing. Yeah. And it's gradually happening, but yeah,
it is on social media.
It is on social media, but not in the general media. You're right. No, not the general media. No, certainly not in general discussions. No.
Because then that will change public awareness of that autistic people are diverse people in many other ways as well.
Exactly. Because it is, I mean, that brings us back to the intersectionality, because it is all more one big, diverse, neuroqueer kind of pot in the end of it all. It's just people being different and non-normative according to various norms. And just one that I wanted to throw into the mix, that I've had a bit of personal experience of, not so much in recent years, but another stereotype, of course, in people's minds of an autistic person is basically somebody with a severe intellectual disability. Now, also be autistic, but the notion a lot of people have of an autistic person, again, usually male, usually white male, sometimes represented in the media, Rain Man, maybe genius as well, like Rain Man, but also clearly needs to live in an institution, that kind of stereotype. And I worked, when I first left college, I worked as a house parent and social skills trainer and things like that with adults with intellectual disabilities, young men with Down syndrome and things like that. And I know from reading the literature that this is true, but I can remember examples. One very strong example of a man I worked with, he didn't have Down syndrome now, but he was classified as having an intellectual disability, and he was partially institutionalized. During the week, he lived in this home where I worked as a house parent, and then he'd just go home at the weekend, and otherwise he lived in this home. I would be convinced, looking back, that he was autistic, though he wasn't diagnosed as autistic. But not only that he didn't have an intellectual disability. I don't think he had any intellectual disability. Right. A very unusual character. I don't know for sure, obviously, but a very unusual character, very intense about his interests, very, different socially, presumably didn't do well in the school system, and was just very quickly taken out of the school system and passed on to another system, which, he actually was fairly happy and got fairly good care. But still, I imagine if somebody had just simply helped him through, he would have, been perfectly capable of living a very different kind of life, So I just think it's one of those many examples of misidentification, intersectionality, vagueness and confusion about what we're dealing with, lack of interest in really finding out what we're dealing with.
Which doesn't just come from nowhere, though, because originally, right from back in the day, we talked about that, in fact, I think in the episode where we did the political autism as political, about how in America autistic people were institutionalized, and that medicalized view of protecting the community from these undesirables, and that's how it was in those days in general anyway, that's what the human race believed in, if you like, and autism was part of that. So it doesn't just come from nowhere. It's still got echoes. These things take a long time, you see, don't they, to disappear.
Well, it's like the softer version of eugenics. I'm also reading Robert Chapman at the moment, the Empire of Normal, Neurodiversity and Capitalism. So I'm steeped in all this stuff at the moment a bit, but but like, yeah, he's drawing the history yet again from up through eugenics into the present day, and like, okay, we're not, what the examples we're giving there aren't euthanasia or enforced sterilization or any of those things, but they're just, put them out of the way institutions, and then at least then they don't get in the way of mainstream society. So it is a kind of a softer euthanasia,
I don't know about you, but I notice when I'm working with my clients that when they talk about their parents, these are adult clients, in their 30s, 40s, 50s, when they talk about their clients, it's very their own parents, I mean, it's very common that the adult client who's talking to me will be saying, oh, well, my parents have got such stigmatized views, it's like I can't have that shame, I don't want to know about it, not just different age, different generation, you see. So it was stronger then. Hopefully it gets weaker and weaker, but should be disappearing really fast. But also geographical differences. If your clients of different upbringing, they're born in different countries, they've lived in different countries, but your client might be British, there's that big difference as well, because geographically we know as well, don't we, when we talk to other therapists, that actually the UK is reasonably forward thinking, actually, and in other countries, even in Europe, France and Belgium and other places, that they are not open-minded. It's still very stigmatized. It's still connected to poor mental health, or learning difficulties. And it's not the same. Not all autistic people have got poor mental health. There is, of course, the minority stress issue here, that can create poor mental health as a result of being oppressed and marginalized. But just being born an autistic person does not mean that is a mental health problem.
No. Now, in principle, it doesn't even necessarily mean it's a problem.
Well, no, absolutely.
The problems come from elsewhere. There's no reason in principle not to be, as happy as human beings can be as an autistic person. Just like with any human being, it's more the circumstances that will determine that, and your developmental history and your life circumstances. No, there's nothing inherently wrong or right, technically, about being autistic. It's just a difference. That's all.
Yeah. And when people are thinking about there's deficit, there's lack, it's like that's the deficit does not reside in the individual. It's a judgment based on some pre-assumed norms, so therefore one is deemed to be natural or normal, like the dominant neurotype. So therefore the ones who are not that are deficient at lack. But there is no deficiency in an autistic individual. There's difference, isn't there?
That's it. Yeah. It's all about difference, as I understand it. And I suppose there is something that people are drawing attention to these days, like Robert Chapman and others, that in some ways the reason that difference is unwelcome is because, society has become increasingly capitalist and bureaucratic and, alienated, as Marx would say. And if you can't fit in with that, then you're not useful to society. It's finding your functional role within capitalist society. Now, I think there's a little more. I agree with that, but I think there's a little more to it as well, because you were talking about various different countries and so on. I think another factor is just simply conservatism versus a bit more progressivism. Like Nick Walker has a wonderful term, I think, which is neurocosmopolitanism. Oh, and he's saying generally the word cosmopolitanism means openness to difference, like a cosmopolitan city, a city that's full of difference and people get on well together and love meeting different viewpoints. And he said neurocosmopolitan is that applied to neurodiversity. But in general, cosmopolitanism is a thing of progressive forward thinking, slightly more modern, often more left wing life, and obviously a lot of the world is not. It's like in Ireland, for instance, you can see that difference. You might not be familiar with it, or you might, but you see that difference very clearly in Ireland when there was a vote, as there was, whatever, 10 years or more ago, on a gay marriage referendum. Happily we passed it like 75%, which was great. But on the other hand, the vast bulk of those who voted no live in the more remote rural areas, and practically everybody in Dublin voted yes. Do you know what I mean? And so there's always that sort of
where the cosmopolitan place is.
Versus the kind of more conservative. And like you talked about people's parents, like definitely some of the clients I have who really have had bad experiences around, coming out as autistic with their parents. Their parents are, they're very conservative, and a lot of things. So there's a lot of tough struggles still to happen there. The quick point I wanted to throw in, because I know we need to finish in a minute, is it's one that you were making, but I really think it's an important one for us to keep in mind. A lot of people point this out in some of the literature. A lot of the progress we're still making, and it a little bit fits with the point I was just making as well. A lot of the progress we are making, and we are making progress, is still too focused on the the Western world, the white dominant Western world. I mean, it's not literally all white, but it's dominated by the white culture. We don't really know yet, what to say. We really can't make any confident statements about autistic people in Africa, or autistic people in China, or autistic people in Russia, or autistic people in so many different places, because it literally just very
not enough data.
No, just very almost no data yet, So we still have a biased view, as we have around so many things, and we should acknowledge that. We won't be able to make proper confident statements about the experience of being autistic until we've gathered much more of the experiences of being autistic, and we should have a bit of humility about that, I think,
quite exactly. And I remember when I was studying the autism course, and there's been an explosion of professional academic researchers who are autistic people in the last 5 years, and I mean a massive explosion. We're not just talking a few more, we're talking like 5 or 10-fold more. I can't remember exactly how many, but thousands upon thousands of papers have been produced in the last 5 years. But you see, of course, that's great, isn't it? But the diversity is not included in the research even then. There's not that inclusion in the research even.
No, because of the structure of society in general. Not specifically just to do with issues around how autism is seen, but also just to do with general societal inequalities and blind spots and
differences in culture, different values and understanding, a different understanding of cultural differences, that can inform policy, actually.
I suppose.
Well, I will say, though, I will end on a cheery note, actually, because Chapman is a very good author.
Yes.
Loads of stuff that person has written is well worth it. And this is a psychiatrist, actually. I think identifies as autistic themselves.
Robert Chapman, he's a philosopher.
A philosopher. Oh, right. Okay.
Yeah. He identifies as autistic himself. Yeah. Interesting story himself. Yeah, actually comes from a very deprived background, very
I didn't know
great poverty. No, only read it recently. From poverty. And he's autistic. He's relatively recently qualified. He's a young enough man, and he's just got his doctorate, whatever, a few years back, and is working now. I think he's in Sheffield Hallam now, or has he moved from there? But anyway, he's good. His documents are very
great. And Walker, as you say, Nick Walker, I'll put those links actually in the show notes, because they're well worth reading. Those two people are superb, aren't they? Amongst others, there's lots of others.
There's loads of great, but they're leading edge. These are the new people. Like Chapman is fairly new, but he's really hitting the right topics.
Remember that article we read in the Psychiatric Times. I know we do need to finish, but that got us talking that time.
That's right.
About the neurodiversity paradigm. So if you don't want to buy a book, just find that article on the internet. It's fantastic.
Exactly.
Yeah.
Anyway, look, more maybe to come back to. Maybe we'll even come back to.
And what will we come back to next week?
Well, that's the thing. Yeah. I don't have something very definite now straight off the top of my head. I mean, obviously there is like lots of political stuff to open up there, but we have already talked a bit about some of that. Well, maybe we just need to think about it and put something out. Yeah.
Oh, the same. I mean, the amount of lists we've made of things that we can talk about.
Literally a list of things there on my desk. Yeah. So we'll definitely come up with something. Yeah. All right. Well, should we leave it there?
Yeah. Great.
Okay. Great.
All right. So we'll stop for now. Thanks for joining us.
Great. Thank you. What about social anxiety, which we said we might come back?
Oh, yeah. We did say we might come back to that. Could do. Or is it too much of the same theme in succession?
Is social anxiety a similar theme?
We could widen it out to anxiety, because remember,
that's true.
Luke Bearden said anxiety is a baseline state for autistic people.
So let's start by talking about anxiety in general, and then we can do
answer that question: is anxiety a baseline state for autistic people?
And we can then do a few sessions maybe on going deeper into social anxiety and worry and health, OCD a bit. That'll kind of carry us then for a few sessions maybe. If we want, we don't have to. We can jump to something else and come back. But
because often as we get talking, it seems obvious then as to what we would talk about next, doesn't it? So
but no, I think there's a few possibilities within anxiety certainly that we could talk about. But let's just start with autistic people and anxiety. Yeah, that's a good idea, I think. It's really important territory.
I mean, it's like a constant feature in
constant
sessions for a start, isn't it?
Constant feature in my life. I just hit a patch of it in the past few days, actually. Yet again, I hadn't had it quite this extent for a while, but it kind of got.
I know it just.
I fell into it again quite strongly there. Yeah.
I know.
Yeah. So,
and are you doing all right?
I'm okay. There's a few specific things, but it is more just a kind of this is how it feels to be different in the world, and you never quite shake it off, that stuff.
Yeah, I know. And we know stuff. So it just reminds you, doesn't it?
I know.
It's like, I remember now just how terrible it is, from the client's point of view.
Yeah. Yes, which is interesting. So I might even talk a little bit about it personally. Yeah. But let's do that. Let's do anxiety then. Yeah.
Great.
All right. Great stuff. Take care.
Yeah. You too. See you next Wednesday.
Yeah. See you then. Bye-bye.
Bye.